So radiation, people will come into my office, and you guys might also be curious, what is radiation? What is radiation? What is chemotherapy? And so on. Radiation is what it sounds like. High energy X-rays, right, that are meant to destroy cancer cells and also to decrease your risk for breast cancer in the future. Typically, the radiation, and I think people in the crowd can attest to it, it's actually very short each day.
Oh, yeah.
Short sessions. They last for minutes at a time, and it's typically given Monday through Friday most often for several weeks at least in a row. And that's how the radiation is delivered. You go into the radiation oncologist office, which is a different doctor specializing only in radiation. You get your treatment, you go home. And the side effects of radiation are, just imagine it like a bad sunburn, right? Skin irritation, swelling, inflammation, sometimes pain. Those are some of the side effects people can develop.
I had very little problems.
Which is excellent.
Yeah, I had 37 treatments, and you know, my biggest problem was keeping the marks on my.
Oh, okay. Yeah. So that's radiation therapy. Now chemotherapy, sometimes we give chemotherapy before the surgery to shrink down the tumor to make the surgery easier. Sometimes. Most oftentimes it's given after surgery. And the decision-making process about whether or not to actually do chemotherapy depends on actually a lot of key factors. One is the age of the woman and how healthy and fit they are. If I have a woman who is 90 with a very small tumor, then I'll talk to them and I'll actually give them some statistics about how much or little they'd actually benefit from chemotherapy. And oftentimes it would be a very little benefit. So age is important. The size of the tumor is important. And whether or not it's gone to the lymph nodes is also going to be very important. Those are just some of the factors that play into whether or not oncologists will recommend chemotherapy for a woman with breast cancer. It's not always, not every case of breast cancer requires chemotherapy, but if you have a very large tumor, if you have a tumor that is considered a high grade, which means it looks very disorganized when examined, if you have a tumor that has spread to the lymph nodes, if the patient is younger, those are all things which might lead a cancer doctor to say, I think you benefit a lot from getting chemotherapy. Now, what is chemotherapy? Most oftentimes, chemotherapy is actually liquid medication. Sometimes pills, less often pills, but most often it's liquid medication that goes into the bloodstream through an IV and goes through the majority of the body to kill off cancer cells and to decrease the risk of cancer coming back. It is given in the setting of cancer that's been taken out completely, right, by surgery, and it's also given in the setting of cancer that's still left behind. For example, a woman with stage 4 breast cancer that's gone from the breast to another organ, another site, for example, lungs or liver, one of the best treatments might be chemotherapy to help them to live longer, to be more comfortable, right, to suffer less. Those are some of the things to consider.
What does neoadjuvant?
Neoadjuvant means chemotherapy before surgery. So sometimes it's given, yeah. All medicine is a lot about knowing long words. Yeah. So neoadjuvant versus adjuvant meaning chemotherapy after surgery. So not every breast cancer requires chemotherapy. There are different factors that we'll consider about how much a woman will benefit from actually receiving chemotherapy. This is a list of chemotherapy drugs, just some of them, which I will skip over. Hormone therapy now. You might have heard of things such as tamoxifen, right? That's a common drug that women will be familiar with. If a woman's breast tumor has those positive estrogen, progesterone receptors, that would suggest that their tumor would respond to hormonal manipulation, changing the hormones in their body. And that's typically in the form of pills. Pre- and postmenopausal women can be considered for tamoxifen, for example, and postmenopausal women can also be considered for one of the newer drugs, aromatase inhibitors. Those are drugs such as Arimidex, Femara, Aromacin. Now, if you have, for example, a breast cancer that has these hormone receptors, if you have the surgery and you're disease-free, you might want to be considered for getting these pills once a day for 5 years to reduce your future risk of having breast cancer. It's also used in the setting of metastatic cancer, cancer that's spread to other organs, to help women to live much longer too. So it's used in different settings, but it's hormonal manipulation.